Thank you for joining this conversation on Advanced Directives with Nicole Christensen. Let's jump right into it. Nicole, what are advanced directives?
Advanced directives are when you are trying to plan for, God forbid, you are incapacitated. So you want to make sure that your wishes are known to those that love you and that can carry out those wishes. There are many parts of the advanced directives, and the main parts that people think about are healthcare proxy, power of attorney, and living will. Now, there are many differences between those. So power of attorney is really talking about money, right? How you want your money used if you become incapacitated while alive. So that's very different from a will. Then healthcare proxy is somebody to make your health decisions if you're incapacitated, again, while you're living. Advanced directives that include a living will is something that you work generally with your attorney to say on paper what you want your healthcare proxy to do. There is something called DNR, and what that means is do not resuscitate. That means if somebody has an occasion in which they can't breathe on their own, they are suggesting, if they have a do not resuscitate, that nobody attempts to have them breathe again. Most times, for younger people, this might not be appropriate. But for older people, or somebody has a certain condition, or they just feel that that's not for them, they can have do not resuscitate. But this is a conversation you really want to have with your healthcare proxy and your doctor so you know exactly what it is.
The language around advanced directive oftentimes include D&I, which means do not intubate. Let's talk about that language and exactly what it means.
Do not incubate is different, right? So you are going to be incubated in some way. You're getting something via a tube. So sometimes we think of that as feeding tubes, which is also something else. So I want people to think about this, and you don't have to have all the answers. That's the thing. It's not like, oh my gosh, I wrote this, therefore whatever happens, they're gonna follow this, and they're not gonna sway at all. No. That's the point of having the conversation with your healthcare proxy. You do not need to make a decision of do not resuscitate or do not incubate or no feeding tubes. You do not have to make that decision. What you do have to do is have that regular conversation with your healthcare proxy. So you can say, okay, I'm 20. This is what I would like, God forbid, if I become incapacitated. I'm 25, I'm 30, I'm 35. You can do it on the fives, whatever works for you. But it's the conversation that is just as important as the paperwork. People who should have a healthcare proxy is any person over the age of 18. There are many examples of this. We hear about it and then sometimes we forget about it, honestly. There are children that go off to college and they have no healthcare proxy, and something unfortunate happens and they're incapacitated. And it might be for a short time, but that parent is calling frantically to find out, to help their child, and nobody can speak to them because they don't have a healthcare proxy.
For people with mental conditions that may face hospitalization, how important is having advanced directives and healthcare proxy in place?
So if you don't have a healthcare proxy and you become incapacitated because of your mental state, then nobody can speak for you. That is considered incapacitated if you are hospitalized for a mental condition, because you cannot, in their eyes, make decisions on your own. So it's so important, and mental health is such a crisis right now. It just underlines the need for all of us to have a healthcare proxy. Everybody should be thinking about this and talking to their friends and loved ones and clients about it, because it affects all of us. Not only if it's your loved one, because nobody wants to be put in that situation, as I mentioned before, of not knowing if they made the right decision, but we heard during the COVID pandemic, all of these people that couldn't reach out, they couldn't even find, nevertheless reach out to the clinicians that were caring for their loved ones to say what they wanted. Even during the pandemic, when you were able, if somebody was in critical condition, to visit them, if you weren't on paper what that critical care meant and you didn't have that healthcare proxy, it made another hurdle in a time of your most stress and most vulnerable. You don't want to have that. You don't want to have those questions. There's something else called HIPAA, which is a privacy, and that's for all healthcare organizations. Unfortunately, it's protect your privacy, your health privacy. So unfortunately, each healthcare institution has a different HIPAA form. So if you have the healthcare proxy, you have that covered. You don't have to worry, oh, they went to this hospital and I didn't have the HIPAA, so therefore they can't speak to me. That healthcare proxy can cover all of it. And although it can be called a healthcare proxy, it can be called a health agent, it can be called different things in different states. But generally speaking, it doesn't matter what state you're in. If you have that healthcare proxy, they're going to rely upon that person. They're going to take that person's wishes, or basically your wishes that they're articulating, into account and do what you ask.
Conversation around advanced directives, having a healthcare proxy in place is very stigmatized around death and mortality. So how do people overcome that stigma and start that conversation?
Think of it like this. Unfortunately, we all know somebody that's been in a car accident, right? And hopefully they came out fine. But there was a moment that they were unconscious, right? And that unconscious is called incapacitated. And so for many of us, if we're in that case, if somebody that we selected as our healthcare proxy that knows that information can then say, oh, my friend, I know that they're on blood thinners, or I know they have diabetes, or I know they have many of the unfortunate diseases that many of us have in the United States. That can save somebody's life. So it's not about just death. It's about helping somebody get the care that they want. If you can't speak, you need to have somebody to be able to articulate that for you. So I know there's a stigma, but let's erase it. To have control of your own care, that's priceless. Just talk about it like that.